a 45-year-old male triathlete, and he's having shoulder pain with swimming, and it gets worse about 20 minutes into a swim, and it's worse when he does faster swimming. And it came on for no apparent reason that he can think of, maybe 6 months ago. And he had an ultrasound scan, and that showed, as he can recall, a small rotator cuff tear and some tendinopathy. But he doesn't know what any of that means. and and he's been Googling, and he's heard of the term swimmer's shoulder, and he's not exactly sure what that means either. I was wondering if you could, maybe could we start there? So what is swimmer's shoulder? Is that a term you're familiar with?
It is, and I think it just it kind of encompasses the vagueness with which we
Hmm.
understand many of these things. So, swimmer's shoulder is really just an all-encompassing term for patients who present having done lots of swimming with anterior shoulder pain that's aggravated by their swimming. But it encompasses all sorts of things like tendonitis, bursitis, impingement, instability, etc. But I guess by putting it under that umbrella, it's really kind of highlighting that being specific about the structure probably doesn't matter. It's just more about getting the rehab right.
Okay. Why do you think that being specific about I mean, in this case, for example, do you think we need to be specific about the individual tissue or structure that is causing the pain or not?
If you look at the current evidence, no, arguably, because it isn't going to change your approach to management, because there's some very common themes irrespective of the structure. But I also think that we have to be honest that, you know, our clinical examination, our clinical tests, and even our imaging, they might highlight something structural, but that doesn't mean it's the cause of some of these symptoms, because we know that we can find all these things if we scan the shoulders of people who haven't got shoulder pain. So I think, you know, from my point of view, I definitely get patients coming to me saying they've been diagnosed with a bursitis or a tendonitis or a tendinopathy based on a scan. And, you know, that's a useful part of decision making. But fundamentally, what I'm most interested in is how things started. So for this guy, the really positive thing is he doesn't give us an acute history of trauma. He hasn't fallen over. He hasn't had an injury where he suddenly had immediate onset pain that stopped him doing what he wanted, had weakness, couldn't do what he wanted to do, and that persisted, in which case that rotator cuff tear might be a little bit more interesting. But in this case, and I'm not saying it's not interesting, of course
Hmm.
I'm interested in the guy, but in the absence of that history of trauma and somebody who swims and swims a lot, then to me, it's just an overuse phenomena.
Okay. So you would sort of, you're most interested in the way it presented, and he's saying, it came on gradually. There wasn't a specific injury, and you put that in one kind of bucket, maybe the overuse kind of bucket. And then if he'd said, I'd fallen, or someone had grabbed my arm as I was like playing sports or something, and sort of wrenched it backwards, and that's when it started, you would look at this differently. Is that right?
Yeah, for sure. So if you, whether you look at labral pathology, so damage to the cartilage in the joints, whether you look to damage to the muscle, the bottom line is, unless you have a clear history of trauma that had immediate onset of pain and loss of function, specifically when you look, and particularly when you're looking at athletes, the bottom line is, without that history of trauma, it probably does just reflect repetitive loading over time. And what's really important to say, particularly in overhead athletes, is that patients who have surgery, perhaps for those cartilage injuries or rotator cuff tears, without that history of trauma, don't do so consistently well, because it kind of, you're messing with a joint where actually that just reflects change in response to the thing that you've done a lot of. Whereas surgery in patients who have had an acute injury, particularly somebody of this age with weakness, then the outcomes are more predictable. But again, even with that description of history, only about 40 to 45% go on to have surgery. So even falling over isn't a game changer, meaning you definitely need surgery, but it will influence my decision making.